My health is precious. The life I live allows me to be a productive citizen in society, and I do not need the effects of toxins in the air, water pollution, or fumes from toxic products being made in my backyard to shaving off days or years of my life. Come with me. Let's ask Joel Reed if he has any information.
Good morning. My name is Joel Reed, and I will be serving as the moderator for the Environmental Public Health Roundtable for the Environmental Justice Education and Awareness Symposium 2021. I'm an environmental health and safety professional, and I've been serving as a technical advisor for environmental justice groups since about 1999. My role as an environmental justice technical advisor is to help the communities understand technology and things like PPM and breaking that down into apples and oranges for those that don't quite understand the environmental science aspect of environmental justice. And I'll turn it over to Dr. Barton.
So, hello, my name is Dr. Jennifer Barton. I'm an associate professor at Mercer University School of Medicine. My appointments are in community medicine, which is like public health and population health, and obstetrics and gynecology. My research is focused on perinatal mental health, so postpartum depression, postpartum anxiety, things that affect the mother during pregnancy and the postpartum period. Lately, I've been hearing things from my colleagues that are in mental health counseling that, they have patients saying things like, I can't imagine bringing a baby up in this world. And some of that's sort of related to the existential crisis of climate and environment. So I became more interested in researching that area. So now we're looking at moms and babies and older children and the interaction between climate and their mental health. Thank
you. I'm Neha Pathak. I am an internal medicine doctor, and I work on the board of Georgia Interfaith Power and Light, and I'm also a founding member of Georgia Clinicians for Climate Action. And I think that my journey to really understanding how environmental justice and climate justice are so important for patients' health is essentially from treating patients and realizing I'm just putting Band-Aids on problems. So people are coming to me with asthma problems, breathing problems, and I do adult medicine, and I'm seeing that they're talking about their children also struggling, and all I'm saying is, here's a Band-Aid, go back to the place where you're struggling with this. And so that's really where the journey took me to learning more about how we can actually do things to treat patients and communities so that we're getting to the root causes of these problems rather than, again, like I said, just putting Band-Aids on them. I'm very happy to be joining with you all today.
Okay. So I'm a pediatrician. I've been in practice for 15 years, and I realized that I've been seeing a rise in the number of children with chronic medical conditions like autism and asthma and ADHD and even cancer. And I realized that environmental exposures were one of the common denominators of that. And so that's when I realized that I had to focus on prevention and advocacy, and that expanded my career into environmental health. So I'm glad to be with Georgia Clinicians for Climate Action. I'm also on the board of Eco Action, a local environmental justice organization. I'm with the EPA's Children's Health Protection Advisory Committee. I make sure that I communicate the health impacts of environmental pollution and also the health benefits of environmental solutions.
Well, good morning, everyone. I am State Representative Kim Schofield, and I absolutely love representing parts of Fulton, Clayton, and the city of Atlanta. I also work for Emory University. I am a lupus researcher, and I do population-based research with chronic disease. I'm a person that lives with lupus, so when I came to this space of environmental health, it was because I knew the tie-in and connection between chronic disease and environmental justice. And so in my legislative capacity, I look to not only educate, but advocate and write legislation that's going to help us move the needle when it comes to social determinants of health, and as we're putting together and really educating the community and each other about the impact of environmental justice on health on a daily basis. So thank you for having me here.
Good morning, everyone. My name is Janisha Obey, and I'm an environmental health specialist for City of Atlanta Department of Watershed. My role at Watershed is to provide the clean water plant and wastewater plant with safety and health leadership. My biggest goal and impact in this field is to try to surpass the racial challenges faced among different exposures among different races. Here, I also emphasize in indoor air quality and the disparities and inequalities in indoor air quality.
Good morning, everyone. My name is Darian Morgan. I am a watershed operations supervisor for the City of Atlanta Department of Watershed, where I specialize in process treatment of water and making sure that we have efficient and effluent that's passing permit standards. My target and my goal is to focus on utilizing our current technologies and also developing new solutions so that we can treat water and face the challenges that we're facing in the environment for the 21st century.
Hello, good morning, everybody. My name is Jomar Hay. I'm a pollution control manager with the City of Atlanta Department of Watershed Management. And in my capacity, I look at the NPDES permits, the annual 305 EPA and EPD permits for solids handling, and I focus on training people in the field and also looking at the process overall of wastewater for good effluent discharge, which goes to the Chattahoochee, which is a major area of study for the EPA with their TMDL and 305B, 303D Clean Water Act provisions.
But I want to talk about the impact of corporations and big industry. And in most cases, let me say this, I'm sure we've all seen the movie Independence Day, right? And I'm making a point here. And the aliens came in to suck all our resources in that movie, right? And move on to the next planet and suck the resources. I kind of compare that to corporations because they target the low-income communities, because they don't have the political power to fight, the influx of waste incinerators and chemical plants that are contaminating the local communities and things of that nature. And I've seen, in my experience, I've seen where some of these chemical companies, they kind of, put the waste on the local communities. So just dump the waste on top of it. And in some cases, in these rural communities, they still have gardens, they still have wells and things of that nature. And then the next thing you know, their kids have, central nervous system issues and things of that nature from exposure to aluminum, lead, and things of that nature. So, Dr. White, what do you feel that, why do you feel that food pollution is an important issue to address based upon that contamination conversation?
Okay, yes. So now we've discussed earlier water pollution and even climate change, and but I think food pollution is one of our most pressing issues because unlike our air quality, which we can always check by looking at the air quality index, and our water quality, you can always get a copy of your local water quality report. When it comes to the contaminants inside of our foods, usually we don't know about it, and it's hard to find that information. And we're finding out that not only is it the heavy metals that, are most concerning, which contribute to central nervous system disorders. I mean, why do we have such high levels of Alzheimer's? And where did that come from? And even Parkinson's, and even, pediatrics. All the kids have ADHD. and developmental delay, and we're getting lots and lots of referrals. But in fact, a lot of that is preventable. But also, not only are we concerned about the heavy metals, but also the other additives. A lot of foods that are marketed to children have a lot of sugars and sweets and coloring in it, which are pretty much unnecessary. That red food dye can lead to it can lead to hyperactivity and also lead to headaches and behavioral problems inside of children. Even the yellow dye can also contribute to sleeping disorders in children. And even with all the hormones, especially, that are added to our meats and even milk products, we're wondering why are these young girls having going through puberty so early. That's not the only reason, but it's a contributing factor. And even, why are we all gaining weight? Why is it so hard to lose weight? With all the endocrine disruptors that are in our food, maybe that could also be contributing to, the hormonal problems that we're seeing. Like even rates of hypothyroidism are rising. Even rates of diabetes are rising. Maybe diabetes, the health disparities that we see that, it's so much higher in African Americans, maybe it's not always just due to our diet and exercise, but it could also be due to these exposures. And also, as a pediatrician, it's so heartbreaking for me to, know what I know, about the environment and then go talk to parents, because the first foods that babies eat, they start solids at about 4 months old. And the first foods are like rice cereal. How can I not tell them about all the arsenic that's inside of rice cereal? Even when some of the baby food manufacturers tried to become more healthy and introduce brown rice cereal, we found out that the brown rice had more arsenic in it because it accumulated the heavy metal. And even just last month, there was a congressional report that was released that found that the baby food manufacturers sold products that their own internal testing showed had elevated levels of lead, cadmium, and arsenic in it. Like you already knew from your own testing, which is why self-regulation, is not going to be key. That's not the solution for us. We need, we need our government, our FDA, our EPA, our Georgia EPD. We need to hold our governments accountable. And even also, the Healthy Babies Bright Futures study, Bright Futures they did a study last fall, and it showed that 95% of baby foods are contaminated with at least one heavy metal. And you think, oh my goodness, I'm stuck. Like, what do I tell them? And even parents, I've had parents tell me they just don't want us to be healthy. And that broke my heart. It's like, and I'll meet some parents who will say, well, I'm just going to grow my own food. But unless you can control the natural elements, you can control the wind and the soil and the rain and the storms, we're all going to be affected unless you can have like a greenhouse. I mean, that would be ideal, but yeah, so the solutions are going to be very expensive and hard to achieve. So that's why we really have to focus on the source. And those
I think the most interesting thing about environmental exposure is that so you can be exposed to an environmental factor and you may not have acute symptoms. So people think, I've been doing this for this amount of years, I haven't been affected yet. But long-term exposures, environmental factors possess long-term exposure. So it develops a chronic infection, and when you identify the chronic disease or whatever illness you have, you don't even remember what you were exposed to because you've been doing it for so long and you don't know if that was that. So it's just hard to kind of track if the links to your chronic infections associated with your environment, because we don't have acute symptoms.
I'm from New York, so I went to school and I went to college in Boston, and back in the 80s. So fast forward, I get to Georgia, migrate eventually to get here in 2000. Well, that's when I was diagnosed with lupus. Nobody in my family had it. No one knew what it was or anything like that. A study comes out that there was a environmental report that went and said that 4 major areas in Boston were infected by, it was actually water quality for lupus. So it goes back to your point. I mean, no one knew. This thing was resignated in 4 of the heavily African American areas that people lived. and there were 92% of the women that got diagnosed with lupus.
Wow.
And you know, our choice of living location is going to be primarily based on what we can afford.
That's right.
You know, but unfortunately, we don't realize that the reason why it's so affordable is because it's near a landfill,
Right.
or it's near a coal plant, right, or near some other point source of pollution. And so, yeah, I think for our protections, we really have to really focus on building our immunity. You know, we think about what we can do. And so even with the food, you know, eat lots of, you know, fruits and vegetables and nuts and berries and herbs and spices. So we can get all the vitamins and the minerals and the enzymes and all the trace minerals and all the other nutrients that can help to boost our immunity, that can help to counter the oxidants, because we need antioxidants from these nutritious foods, because this is going to help to counter all the environmental pollution and boost our immunity, so at least we can have a chance. But once again, those fruits and vegetables, it must be safe.
Right. So you have the food insecurities on this end. You have the lack of access on this end. And so, every time I sit in a room with you, I get another laundry list of things that I've got to fight. But after that, it's just like you're just pulling off layers on top of layers on top of layers. It has to be held at its top. You've got to start at the top.
And I'm sorry to interrupt, but I think that is just such a critical lesson. And I always now like to bring it back to COVID, because I think it really paints a picture in people's minds, which is that the way COVID, you may have gotten it several weeks ago, you didn't know, and now if you're feeling the impacts weeks later, environmental pollution, climate change, you're going to put that time scale on decades later. So yes, we can't say specifically, and I think people use that to kind of send people on the wrong path, that, well, you can't say that this was really the cause of that. But what we can say is we have lots of studies that show that this heavy metal or this chemical in groups of people causes higher rates of cancer, causes higher rates of learning disabilities. So though I can't specifically say for you this is the cause, I can absolutely say don't get let off the path by that argument, because we can absolutely say these groups of people have a higher risk from this. And then I think the other thing is the way that we prescribe. I always kind of come at this as a doctor. So if I can prescribe you insulin, why can't I prescribe you healthy foods? Why can't we make that mandated? Like the way that I could write a prescription, and your access to that prescription is just accepted. We just accept that if I write you insulin, you should be able to find that somewhere, and your health insurance needs to be able to cover that. The same way for healthy exercise prescriptions. Healthy, and we can't be thinking about things as one-off. If I'm seeing someone coming in with allergies and they're living in an apartment complex with mold, I shouldn't just be treating that one person. I should be treating that apartment complex. Like the prescription should be for the community. And I just think that that's just such a critical point. So thank you so much for both.
Well, Brady does have that program,
right?
Before COVID.
It just needs to expand.
Right. But again, it goes back to money and resources, and then the timing on the phone.
And just to quickly touch on the foods. So I'm Jamaican. When I grew up, we essentially ate everything that came up out of the ground. The camp, farmers market, and other places like that have those foods, that dasheen, that yellow yam, that white yam, those spices and stuff that y'all were talking about. Those are good enough supplements. My dad, he is almost 60 years old, and he's 5'10", 130 pounds. He eats starch-based things, but the amount of nutrients that it has is so explosive that, it also helps that he doesn't eat, some of those processed foods. But I think it's focusing on a shift of what type of food we eat, from the process over to some of those, those yams, those dasheen, the pumpkin, stuff like that. That definitely does help. And so I think we do need to advocate a lot for that instead of those food deserts where it's only McDonald's or Burger King or whatever, that we start, a shift to saying, okay, maybe we're not, having those cooked foods, but hey, here, we can, give you some of the resources to help you. You can cook those. Boiling is one of the primary ways of making some of these foods. And I mean, it's simple, easy, cost effective, but I just wanted to kind of bring that up.
And I 100% applaud you. I have a garden in myself. I'm a New Yorker that I've never done gardening until I moved here. And I love it. But the average person works 2-3 jobs. They don't have time to grow. In my neighborhood, well-known chain, I've asked for several type of why don't we have food in our neighborhood that is dealing with low sodium, low fat? Because my neighborhood does not want that. They won't eat it. And we've done all kinds of evidence-based programs or food programs and this, that, and the other. So there's got to be another layer up. And we're going to all have to start at the top and start really embarrassing folks and calling it out and I think we have a great opportunity because with the COVID and everyone is embracing science, let's start bringing out science in other areas now. Yeah. And since we're accepting science on COVID on some levels, let's start bringing it out on the food and the other areas and the climate. Yeah. And you're going to have to keep messaging all levels. It's a process. We may not see the effect in our lifetime, but I guarantee you, if you keep being persistent, that we're gonna start holding people accountable, or else those that are in policy won't be back. Those that are heads of these companies will not be back. We'll have to shut it down. We're gonna have to take this is environmental justice. So I think we have to start looking at the justice part of this.
Yes.
And moving us along.
Yeah, one thing I would say is people tend to think that income would be the number one determinant of life expectancy, but it's not. It's education level. And the more people that you're around that are educated, when to get your colonoscopy. You know these basic things that can make a big difference. If you hear people that get colon cancer in their 50s, they could have lived another 15 years. Colonoscopies can be thousands of dollars. So, it all kind of circles back to this larger issue that you're talking about of, resources.
Well, and thank you very much. I think you hit on some key nuggets here. When we obviously talk about an aging infrastructure, you've got to talk about what we can afford to do on a state level. So money is always going to be the driving force, whether we like that or not. And so it's looking at finding solutions in the state budget to offset some of these issues in aging systems, whether it's on a state or local level. We've got to start making this a priority. And we don't make it a priority until it becomes a priority. For example, when you said the water pipe bust and we know it's old and needs to replace, then we're going to start to do it. So when are we going to start being a little bit more proactive instead of reactive? That's my first thing. And in terms of the workforce, I think it has to be an intentionality now, because we know that the racial divide and the racial disparities that go on in environmental justice as a whole impact our communities. So why not start getting our students and communities involved on the front end? Let's start creating jobs in our community. If the average age is 49, then we should be actively and I'm going to make a note that to myself to reach out to you guys and find out about that program in Florida. And let's start doing this in some of the high schools as well as the colleges, that we start bringing in the people that we need. We can't fix a problem by just talking about a problem. We've got to start addressing and putting the resources behind the problem. So I also think that the education in the community is key and vital. I know Dr. White will say a lot about the work that she continues to do, but we've got to start educating people about water. What is the problem? I drink water, but that's not enough to just understand the implications, health, environmental, and economic. All of these things are interplayed and they tie into one another. I think we at the table know this, but we've got to start branding that messaging out a little bit so that the average person understands the value and why we need to do this now rather than later.
Awesome.
Is there anyone else that would like to chime in on this subject?
That was great points, but I think something to add is that we have to educate the public and let them know that the quality of water starts at home. So what you throw down your drain or what you flush down the toilet also always impacts the quality of water that the plants are. It's easier for them to clean it. So I think they need to know that clean water, safe water starts from home.
I'd also like to just piggyback off of what Darren was talking about. Some of the solutions that we can look at is actively grouping with either the state or private sector to help addressing some of the water quality concerns that we have. The operating costs for treating water and treating wastewater, is just going up and up and up. There are medications and chemicals that are getting more and more complex entering the waste stream, and the way that these plants operate is not necessarily the most efficient. And even down the road, solids handling and solids disposal, landfilling issues are becoming more of a problem. We have to start switching to Class A. But there goes back to what our representative said, that the cost is so great that you have to start actively partnering with some of these private companies in working with the state in getting an amended permit for what you're trying to do, whether it's your phosphorus levels, your lead, your iron, your selenium, your zinc, what have you, that's going into the soil, because eventually it does lead back to the water. Those are some of the things that we can start to actively trace and actively get a better understanding of. And wastewater and water, almost the perfect place to see how the community health is actually doing. So those are some of the ways that, I think Ms. Morgan and all of the rest definitely pointed out. So we should definitely head in that direction. That's a good solution.
Also, make a point on this. I just think it's so fascinating and important, the discussion about cost. And as we're thinking, because at the end of the day, the cost is always the overriding factor. So when we're making these kinds of balance sheets, are we putting in the input cost at this current time and balancing that against, okay, now all of the costs, and we don't look at the healthcare costs in the long run, the educational costs in the long run, the costs to just all of the other costs in our community that accrue, and can we tally that against this initial cost that we're talking about? I'm just curious about that from the state level, from the local level, and then from the family level too. Are we thinking about these things as a health professional? When I see patients, when I am prescribing you a medicine, can I spend 5 minutes and instead take on the cost of talking to you about health risks that you might be experiencing in your home, that I can then counsel you to protect you and prevent you and your children from having these conditions, versus just saying, okay, here's, this medicine costs a certain amount of money as well, and that's going to accrue over time. Instead, can I focus on a root cause that's going to cost less over the long term?
Awesome.
Yeah, I think too, this is something that we do as part of the Georgia Clinicians for Climate Action, is talk about kind of making the connections, because I think a lot of people don't understand. They can kind of understand air pollution or like an oil spill, but how climate and environment interact. I think that's like, there's a kind of a missing connection there. They can sort of conceptualize air pollution, but with rising temperatures, that aggravates air pollution, which aggravates asthma. And kind of making all those connections, I think we're not quite there. We understand it, but it hasn't permeated into the public, and even firmly into medical education. I joke about this because we always put it back. Anytime we're writing a paper, I'm an epidemiologist, not a clinician, but I work with clinicians all the time. The final paragraph of a paper is always, what needs to happen next? Well, our clinicians need to take more time to ask about mental health, and they have a waiting room that's packed. So it's, in a way, I always think we put everything back on them. But on the other hand, they are ambassadors for health in these communities. So them understanding how all of it's connected is really essential, and we need to get them at the trainee level. And this is nurses, physicians, everything.
There's been a wealth of knowledge that's been shared here this morning. I think we all have learned from one another. Okay, I want to thank everyone for joining our Environmental Public Health Roundtable for the Environmental Justice Education and Awareness Symposium 2021. It's been a pleasure. Thank you very much.